an additional week or two. The final point I would make is the question of why are they bringing it before the advisory committee? And that raises the broader question here of whether or not the agency is going to consider vaccines that don't reach their 50% threshold approvable. The reason they deferred, at least in part, the reason they deferred the Pfizer vaccine previously is it didn't meet that threshold. So this is going to be controversial before the advisory committee. That's why they're taking it before that AdCom. I hope there's a favorable outcome for one or both of these vaccines, but I do expect there to be some pushback among those members.
When we spoke back in January about where Pfizer was with its submission, you did make the argument that it might be advisable to make just 2 doses available while they looked at a third, because some protection is better than none. Is the FDA thinking that way? You mentioned a 50% efficacy rate. If the data isn't meeting that benchmark, should these vaccines still be approved?
Well, the data won't reach that benchmark. The Moderna data is about 40% in the data they released. The Pfizer data, the previous data was about 40% as well. We'll see if the third dose provides additional protection on top of that. But we know these vaccines aren't working very well against Omicron at preventing symptomatic disease. I do believe from a clinical standpoint, there's value in getting baseline immunity into children, even if you're not going to fully protect them against symptomatic illness. If you could protect them against severe disease and hospitalization, that provides a lot of value, especially children who are vulnerable, who have health conditions. So I think for FDA to authorize these vaccines, they're going to have to come to that view as well, because these vaccines are not going to meet their pre-specified target of providing 50% efficacy. We know that right now. I mean, it's possible that the third dose of the Pfizer vaccine will reach that benchmark. I don't think that's going to be the case, because I don't think there'll be enough symptomatic cases in that data set to evaluate.
This is an important conversation. We're going to continue to have it and watch what the FDA does very carefully. Thank you very much.